Committee of the Umibiri, the 9th Umibiri University of Health and Life Sciences Conference. Guest of honor, Professor Joyce Ndalichako, Minister for Education, Science and Technology of the United Republic of Tanzania. The Chairman of the Umibiri University of Health and Life Sciences Council, Dr. Harrison Mwakembe, Chairperson of the Organizing Committee, Professor Emeritus Mekzedek Reshabari, the Mr. Johan Helmström, the CEDA Coordinator for Research and Innovation at the Swedish Embassy in Dar es Salaam, the representative of the Executive Director of Muhimbili National Hospital, the representative of the Executive Director of Muhimbili Orthopedics Institute, the representative of the Executive Director of Jakaya Kikwete Cardiac Institute, the Executive Director of Ocean Road Cancer Institute, Dr. Julius Waislagi, Deputy Vice Chancellor responsible for academic research and the consultants at MUHAS, Professor Aprinari Regamadila Kamuhabwa, Deputy Vice Chancellor responsible for planning, finance, and administration at MUHAS, Professor David Paradiso Rasa, Vice Chancellors, Deputy Vice Chancellors, and the principals present, heads of the government and the other institutions, development partners present, government officials present, distinguished delegates, academicians and scientists, representatives from the media, ladies and gentlemen. On behalf of the community, of the management, faculty, scientists, and the technical staff, and our collaborators and the students of Muhimbili University of Health and Life Sciences, and on my own behalf, I would like to take the opportunity to extend a very special and a warm welcome to you, guests of honor, and to all participants for being here today. We are all delighted, grateful, and feel honored to have all of you in MUHAS venues and online to follow and participate our 9th MUHAS Scientific Conference. Please allow me to convey my special appreciation to you, Professor Joyce Ndalichako, our Minister for Education, Science and Technology of the United Republic of Tanzania, for accepting our invitation and sparing your invaluable time to come and officiate at the opening of the 9th Muhimbili University of Health and Life Sciences Scientific Conference. It is indeed a rare privilege to have you here, owing to the busy schedule and the equally important tasks and the responsibilities you have set aside for just this occasion. Thank you very much for joining us once again. Guests of honor, ladies and gentlemen, over the 5 decades period, MUHAS has grown from a small unit enrolling 10 students and with a single program, Doctor of Medicine, way back in 1963, to an over-expanding institution enrolling around 450 students in 7 diploma programs, 15 undergraduate programs, and 81 postgraduate programs. To this end, MUHAS continued to grow and expand teaching and the research environment while taking a leading role in providing consulting services and advice to our government as well as the international community. May I take this opportunity to thank the government of the United Republic of Tanzania for the immense support bestowed to the university that has enabled the institution to implement her mandate. Through the support of the government and that of our development partners on research and training capacity building, MUHAS has continued to be a reliable national hub for research output, supporting policies and the guidelines and supporting other institutions in the country. To date, the university has 112 ongoing research projects and programs, working with more than 90 international and local collaborating institutions, and producing between 450 to 500 academic papers in reputable international journals each year. This research output has been a result of efforts of MUHAS scientists, faculty, and our collaborating partners. The journey towards reaching the research university status is being slowly realized. MUHAS has also continued to grow and expand physical teaching and research environment. The realization of the dreams to have centers of excellence in various areas of global and local importance. Phase 1 construction of the Center of Cardiovascular Center of Excellence at Mloganzila campus is at the final stages, and we expect it to be completed in December this year. It is my sincere hope and request that this support is expanded further to enable establishment of more centers of excellence at Mloganzila campus. MUHAS is also starting the construction of the College of Medicine at the new Mloganzila campus, a dream we have been having for a long time. This will not only strengthen the university's capacity to perform the core functions of training, research, and service, but also address the nation's needs that will continue to change owing to the changes in the disease landscape, health, and development needs. Guests of honor, ladies and gentlemen, research conducted at MUHAS addresses priority areas in line with the Tanzanian National Strategy for Growth and Reduction of Poverty, 2005, Tanzania Vision 2025, and the Global Sustainable Development Goals that oversee the country's social economic development. Currently, our research priorities includes HIV/AIDS, tuberculosis, malaria and integrated tropical diseases, reproductive, maternal, newborn, child, and adolescent health, non-communicable diseases, health systems research, social determinants and social conditions of health, injuries, emerging and re-emerging infections, oral health, mental health, pharmacovigilance and the rational use of medicines, occupational health and safety, hematological disorders, traditional medicine and natural products, development, bioethics, drug discovery and formulations. And last is knowledge management and informatics. Research output from MUHAS has informed the policy over time. It has not been possible to mention all implemented activities in which MUHAS has made a significant contribution, but some of the examples include development of the national testing algorithm for HIV and the malaria diagnosis, establishment of appropriate technologies for improved early laboratory detection and the monitoring of HIV infection in Tanzania, and the generation of evidence-based information for guiding the development of strategies for care, treatment, control, and prevention of major infections like HIV, tuberculosis, and malaria. Implementation research at MUHAS has also led to the establishment of harm reduction interventions, including establishment of methadone-assisted therapy clinics in Tanzania. Early evidence generated through hard work by MUHAS scientists led to the establishment of the first clinic addressing mother-to-child transmission of HIV, and subsequent improvement in clinical guidelines to prevent mother-to-child transmission. MUHAS faculty has participated in research that led to the development of insecticide-treated nets for the prevention of malaria and the development of new methods for analysis of pharmaceutical drugs formulation. Such innovations go to the history of game changers in ameliorating diseases burdens and the sufferings of our people and ensuring their productivity for the nation development. Along these lines, MUHA has been able to actively participate in the conducting of clinical trials, including HIV vaccine trials and the tuberculosis vaccine and the treatment trials. Guests of honor, ladies and gentlemen, as an institution for human resources for health training, we owe so much of our faculty development to research. More than 95% of academic staff at MUHAS with PhDs were trained with support from research projects and the grants aiming for capacity development. In addition, resources obtained through collaborative research with local and international partners have enabled the university to develop infrastructure to support academic and research activities. As a result of these developments and opportunities to conduct groundbreaking research, MUHAS has been able to retain majority of the trained academic staff. For this, we are very grateful to the government of the United Republic of Tanzania for creating an enabling environment which has been critical in forging these collaborations with our partners. May I also take this opportunity to thank all partners, collaborators, funding agencies, as well as local and international organizations and institutions for the support they have given us that has contributed immensely to building research capacity and the generation of research results to inform policies in the country. I will not be grateful if I will not mention the Swedish International Development Agency for heavily investing to improve the human and the research capacity at our university. To all our voluntary partners, thank you very much for making our institution continue to lead in research and training and consultants. Guests of honor, ladies and gentlemen, as I come to the end of my remarks, let me again register my great appreciation to the government of Sweden through SIDA. Through this longest collaboration, SIDA has been the main sponsor of our conferences for the 9th year running. Thank you very much. It is my sincere hope that Sweden will contribute to collaborate with us, particularly in development of much needed research infrastructure that will contribute to the sustainability of the investment in human resources, development so far, and research outcomes. Let me also sincerely thank the MUHAS faculty and the support staff for having conducted research and made this conference a reality. My special thanks goes to the Director of Research, Dr. Bruce, and his team for coordinating all preparations for the conference. Also, the organizing committee under the chairmanship of Professor Emeritus Melchizedek Shabari, for chair of the scientific committees, Dr. Edward Kija, chair of the Logistics Committee, Ms. Helen Mtui, and their members for their tireless efforts that have resulted into our getting together on this special day. I say thank you very much. Yes, so honor, ladies and gentlemen, without further ado, it is now my sincere honor and a great pleasure to welcome the chairperson of Muhimbili University of Health and Our Sciences, Dr. Harrison Mwekembe, for his remarks, and to welcome the guests of honor to officiate this scientific conference. Thank you very much.
Guest of honor, Professor Joyce Chako, Minister for Education, Science and Technology, Professor Andrea Pembe, Vice Chancellor, Muhimbili University of Health and Allied Sciences, MUHAS, Professor Polinari Kamuhabwa, MUHAS Deputy Vice Chancellor, responsible for academic research and consultancy, Professor David Urasa, MUHAS Deputy Vice Chancellor, responsible for planning, finance, and administration, Chairman of the organizing committee, Professor Emeritus Shabari, our brother SIDA coordinator, Executive Director of the Jakaya Kikwete Cardiac Institute, Professor Mohamed Janabi, Executive Director of the Ocean Road Cancer Institute, Dr. Julius Maiselage. Well expected to see Professor Museru of Muhimbili National Hospital and Dr. Boniface, Executive Director of MOI. I hope they'll join us later. Vice Chancellors, Deputy Vice Chancellors, and principals from other universities and colleges present. Heads of government and other institutions, representatives of development partners present, government officials, distinguished delegates, academicians and scientists, students, conference organizers, representatives from the media, ladies and gentlemen. Let me join the Vice Chancellor to warmly welcome you to this special annual scientific event by the Muhimbili University of Health and Allied Sciences. This is the 9th MUHAS Scientific Conference. Here today, again, to witness another milestone in the discipline activities from various disciplines within MUHAS and other universities and research institutions. Let me also take this opportunity to thank you, guest of honor, for agreeing to officiate this conference. I thank you personally and your ministry for continued support to MUHAS, especially overseeing training in undergraduate programs, sponsorship for master's and PhD programs, infrastructure development at the Loganzira campus, and research and training support to the university. Such important support has in no doubt led to high impact research conducted at MUHAS. In other words, as a result of the support we enjoy from the government and development partners, MUHAS is doing exceptionally well in its core functions to teach and research. I humbly request you, guest of honor, to convey our heartfelt gratitude to the government of the United Republic of Tanzania for their support accorded to MUHAS over the years. Growing health demands and growing health concerns compel us to request for continued and increased support, especially in terms of local funding opportunities for research. Supporting new ideas requires significant financial backing. With us again, humbly request the government for continued and increased support to sustain research work and innovations arising therefrom to buttress socio-economic development matching the 6th-phase government's vision, Tanzania ya viwanda. Guests of honor, ladies and gentlemen, an academic institution gains visibility when people and other institutions become familiar with its work and think highly of its contribution in improving lives and national growth. With strong competition amongst institutions, it is imperative that quality matches the quantity of research and scientific output. Such characteristics can be evident when scientific discoveries, innovations, and evidence generated are disseminated in scientific forums such as this one. For MUHAS to achieve its vision of becoming a university excelling in quality training of health professionals, research and public services with a conducive learning and working environment, it needs to become more innovative, more transformative, and more research-oriented. For this to happen, MUHAS and other academic institutions must be facilitated and encouraged to generate new ideas with high impact in science and technology that can be transformed to market-ready products or services. Innovations that can create new markets, sometimes even new industries that can create new ways of thinking and employment, and that can create a future different from and better than the present. In other words, such institutions should generate innovations that lead to real economic growth and transform people's lives. It's only through sustained government support to MUHAS and other national research institutions in the form of resources, human infrastructural and financial, our local research institutions will be able to produce groundbreaking discoveries and innovation. Empowering research institutions like MUHAS to pursue research for innovations and inventions will enhance their research leadership role in the country and hence acquire global academic visibility. Guests of honor, may I take this opportunity to thank the Vice Chancellor and all those who made this conference possible. To this end, I also join the Vice Chancellor. Thank all the academicians, scientists, students, and the general public for attending the conference. I wish you all fruitful presentations, discussions, and deliberations. It is now my singular pleasure to invite you guests of honor to the marks and officially open the 9th MUHAS conference. Thank you very much for your attention.
Can we give another big round of applause to the MUHAS? The guest of honor, technology has advanced, and you may wish to be informed that this conference is actually a hybrid conference. So it is both a physical conference as well as a virtual conference. In this room, and of course virtually, we have a number of people who are following up this conference. And suffice to say that in here and other areas, we have members of the academic staff, but we also have students at both all levels, the undergraduate students as well as postgraduate students. But the guest of honor, as we know, the university conducts research, comes up with policy recommendations, and we have implementers of whatever we recommend to the current ministry. So I'm happy to formally introduce Dr. Ntuli Fakologo, who is the Director for Health, Nutrition, and Social Welfare in the Kingdom of As has also been said, with your permission, the Honorable Minister, before you deliver your opening speech, we have someone who is representing a country that has been extremely supportive to whatever is going on at home. With your permission, may I give 2 or 3 minutes to Johan from the Swedish Embassy to deliver the remarks.
I'll take this off so I can read. Dear friends, colleagues, researchers, students, As you heard, SIDA supports research of relevance to poverty reduction and sustainable development. We assist in building research capacity and systems for research and research-driven innovation. And the aim is to save lives and lay the foundation for every person's right and opportunity to live a decent life. So Swedish research support stands on 3 legs. We build research capacity to create sustainable, self-generating research environments. And we support research in natural health, social sciences, and the humanities, and we support applied science as well as basic research. Also, we promote research-driven innovation by supporting local and regional innovation systems. This conference is an excellent showcase of things that we are proud to support. At the core of this support are the partnerships. And the partnerships that are going on. Linkages between. All right. Linkages between researchers here at MUHAS and researchers in Sweden, and linkages between different kinds of research environments. In Sweden, we have the University of Uppsala, we have Stockholm University, Umeå University, and Karolinska Institute. I'm sure that you are all familiar with those 4. See that we have worked together with MUHAS since 2008, and we are looking forward to design the next 5-year phase, starting July next year. And again, this is something that we will do together, Pamoja. Thank you, MUHAS, for all the great work. And I'm really looking forward to learn more at this conference. Thank you.
So you can all see me now, eh? Guests of honor, you have already been invited to the podiums by the MUHAS chairperson. So please.
Dr. Harrison Mwakembe, Chairperson of Muhimbili University of Health and the Allied Sciences Council, Professor Andrea Pembe, the Vice Chancellor of MUHAS, Deputy Vice Chancellors, Professor Rishabali, Chair of the Organizing Committee, Mr. Johan Holmstream, representative from SIDA, Professor Mohamed Janabi, Executive Director of Jakaya Institute, Jakaya Kikwete Cardiac Institute, Dr. Julius Maisalage, Executive Director of Ocean Road Cancer Institute, Dr. Ntuli Kapologwe, Director of Health, Nutrition and Social Welfare at Presidency Office, Regional Administration and Local Government, heads of development mission present here, government officials who are present, distinguished delegates, deans and directors, academicians, and the scientists, conference organizers, students, representative from media, ladies and gentlemen, good morning. Nawasalimia kwa jina la Jamhuri ya Muungano wa Tanzania. Thank you very much. First and foremost, I would like to thank the Almighty God for the gift of life and good health that enabled us to gather here today for this important occasion. I thank the management of MUHAS for inviting me to officiate this very important scientific conference. Indeed, I'm honored to be at an institution that has made significant contribution on the health sector in Tanzania through training of qualified human resource, providing quality public health services, and conducting research that is responsive to the needs of the country. Ladies and gentlemen, I'm told that this year's conference draws scholars, scientists, academicians, development partners, policymakers, and other stakeholders from within and outside the country. You have come together to discuss, share, and exchange scientific knowledge that will eventually improve health status of our respective countries. Scientific knowledge exchange in this kind of conference helps us in the government in many folds, including improving guidelines for management of our patients, developing preventive measures against diseases, helping to reduce suffering from those who get sick, helping sharing common challenges and require your scientific skills to address them, sharing common challenges that require your scientific skills to address them, and helping to put our country in scientific world map, learn from others, and adopt the best practices for improving our provision of health services to the clients. Ladies and gentlemen, I'm informed that the growing awareness of the MUHAS annual conference, I'm informed of the growing awareness of the MUHAS annual scientific conferences. This is evidenced by an ever-increasing number of delegates from 280 during the first conference in 2013 to more than 400 in the recent years, and hopefully even greater number in this year. It is without doubt that using a visual platform enables those who cannot attend the conference physically to participate in this important event while away. For this reason, I congratulate organizers of this conference and the university at large. The increased number of conference participants shows that these annual scientific conferences are useful forums for disseminating new research findings, knowledge, and innovations by the university to inform policymakers and health providers. I urge you to continue with these ambitious efforts in improving quality of scientific studies and dissemination, as well as showcasing the novel findings of your research, which will ultimately enhance your institutional global presence. Ladies and gentlemen, I have been informed that strengthening research and teaching environment at MUHAS is going on well. Such efforts like establishing the Center for Excellence in Cardiovascular Sciences at Mloganzila campus will further strengthen your capacity and competencies in training, service provision, research, and dissemination activities. It is the government's expectation that this center will support MUHAS to conduct cutting-edge research in health and provide state-of-art healthcare services here in Tanzania, with the added benefit of reducing the number of patients referred abroad for treatment. This will also save a significant amount. This will also save a significant amount of money that the government spends referring abroad, and thereby providing opportunity to improve the health system in general. Ladies and gentlemen, the government of the United Republic of Tanzania expects that the research findings emanating from MUHAS and other research institutions locally and abroad are disseminated at platforms such as MUHAS Annual Scientific Conference. The government of Tanzania further anticipates that knowledge and innovations shared here and in other similar platforms on the determinants of health will be translated into products of high quality services that can be commercialized for the benefit of all Tanzanians. Ladies and gentlemen, the theme of this conference, opportunities and challenges for tackling imaging and re-imaging health challenges, is both timely and relevant to the country and globally in general, where the emphasis of imaging and re-imaging health challenges is extremely needed for healthier and productive population. For more than a year now, our country and the world have been facing the challenge of COVID-19, which is an emerging condition affecting each sector in one way or another. Apart from COVID-19, we still have other conditions that have existed for many years, which are now emerging or they are now becoming a problem. Now, while we feel like defeating diseases of concern and those of public health importance, such as HIV/AIDS, TB, newer challenges such as non-communicable diseases among the general population and amongst people living with such chronic conditions threatens our health system. We have other growing concerns of drug resistance that further put our success trajectory to a test. Therefore, this scientific conference is an important forum for scientists to present their research work looking into all those problems, how big they are, how do they affect us, and all these problems, how big they are, how do they affect us, and what are the probable solutions. We in the government believe to get some answers from this and similar platform. Ladies and gentlemen, it is well known that there can never be a true economic development without a healthy society. Consequently, it is of paramount importance that the type of research conducted by universities of health sciences and health institutions like MUHAS is relevant to Tanzanian communities. Through this approach, we can expect research results to solve health problems and challenges of the population and improve lives of Tanzanians. I'm proud to note that most of researches conducted by MUHAS have guided the formulation of policies, guidelines, and procedures for the health sector in the country, which have positively impacted the lives of Tanzanians. Ladies and gentlemen, as our country today faces emerging and re-emerging global health challenges such as COVID-19, climate change, non-communicable diseases, and aging, and depletion of natural food resources, we need to apply transdisciplinary health approaches for Tanzania to effectively be able to address all its health challenges holistically. Today's health research has to integrate concepts and approaches from several disciplines, tapping into knowledge both from academic and non-academic actors. It is only through promoting and embracing transdisciplinary collaborations we will be able to spearhead innovative and high-impact research outcomes that will deliver permanent solutions. I've noted that MUHAS has embraced this transdisciplinary collaboration spirit as reflected within the framework of your conference scientific papers that covers 13 sub-themes as indicated in the program. Ladies and gentlemen, concerning emerging conditions, it is my hope that this conference will be able to describe our problem in the local context and propose possible solutions in some of the challenges that our government is facing in addressing COVID-19 pandemic, which are specifically and applicable in Tanzania. Second, it is my hope that this conference will provide recommendations in addressing other re-emerging challenges, such as resistance to TB, HIV, AIDS, and antimicrobial urgency by giving a picture of the burden and how to address related challenges. It is also my expectation that the conference will address issues related to non-communicable diseases, including, but not limited to diabetes, hypertension, and cancer, which currently affect the people of United Republic of Tanzania. And I'm glad that the head of Jakaya Kikwete Cardiac Institute and head of the Ocean Road Cancer Institute are present here along with other heads of key health institutions in our country. This is an appropriate platform to give us a burden of the condition of non-communicable diseases and how different stakeholders in collaboration with the government will be able to resolve these challenges. I would like also to point out that for MUHAS to effectively address our national health challenges, there is a need to extend its collaboration with other research partners locally and internationally. This may include those in the fields of agriculture, wildlife, education, climate, material science, laws, ecology, and geology, to mention just a few. MUHAS is therefore encouraged to strengthen this collaboration in order to conduct researches that will not only lead to new products and services, but also contribute to development of evidence-driven policies to enable the nation to attain the desired social economic development. Ladies and gentlemen, the government has always been in favor for supporting and creating conducive environment for research in education and health sector. We are committed to continue supporting MUHAS in its research and health service delivery efforts within available research resources. Our development partners have been with us throughout the way in addressing our resources challenges, and I therefore like to take this opportunity to extend my sincere thanks to them for their support, which has enabled institutions like MUHAS to excel in research. Specifically, I would like to convey our special gratitude to the people of Sweden through SIDA for their continued contribution. For their continued contribution to research over the years, and by being the main sponsor of this conference for the 9 consecutive years. It is my sincere hope that Sweden will continue to collaborate with us, particularly in development of the much needed research capacity, human resource, and infrastructure to ensure that the efforts are sustained. Let me also extend my sincere gratitude to other major MUHAS collaborators who have provided commendable and valuable support to the multitude research activities of MUHAS. On behalf of the government of the United Republic of Tanzania, led by Her Excellency Samia Suluhu Hassan, I would like to say thank you very much for your support and friendship. Ladies and gentlemen, last but not least, let me take this opportunity to thank all researchers who will be presenting their research findings in this conference. Without them, there could be no conference. Since it is an annual event, subsequent success for such event depends on substantial research outputs to sustain the conferences. It is my sincere hope that you will continue to do research with even more vigor, energy, and diligence, so that we may realize this year's conference theme of opportunities and challenges for tackling emerging and re-emerging health challenges. With these few remarks, it is now my honor to declare the 9th Muhimbili University of Health and Allied Science Scientific Conference officially open. And I wish you all very fruitful deliberations. Thank you very much for listening. Thank you very much.
Thank you. Thank you very much, the guest of honor. Thank you very much, the guest of honor, for a very powerful and good speech. You have raised your expectations. The audience have heard very well, but you have also given specific directives, especially the directive that we work together with other sectors. But also you have assured your committee and the commitment of the government of the United Republic of Tanzania to continue supporting MUHAS in this important endeavor. We thank you very much for that. And I think we have to give an even stronger and bigger round of applause to the guest of honor, the Honorable. So may I now invite Professor Polinari Kamuhabwa to give vote of thanks.
The guest of honor, Professor Joyce Ndalichako, the Minister responsible for Education, Science and Technology, Dr. Alison Makembe, the Chairman of the Muhimbili University of Health and Health Sciences Council, the Vice Chancellor of MUHAS, Professor Andrea Pembe, the Deputy Vice Chancellor responsible for Planning, Finance and Administration, our colleagues from our MUHAS teaching hospitals, Professor Janabi and Dr. Julius Maisalage, our colleague, Dr. Tuli Kapologwe, Director of Nutrition, Health and Social Welfare from the President's Office, Regional and Local Government. We have our representative from Swedish Embassy, Johan, heads of government institutions, government officials, other delegates. We have our colleagues, professors, lecturers, and other staff, students, and representatives from media. Good morning. So my task this morning is to give a vote of thanks to our guest of honor, Professor Joyce Ndalichako, for coming here today and for supporting MUHAS. So let me say that we thank you very much, Professor Ndalichako, for accepting our invitation to officiate the 9th MUHAS Scientific Conference, despite your busy schedule. But let me also, on behalf of MUHAS management and community, convey our gratitude and appreciation to the government of the United Republic of Tanzania and the Minister of Education, Science and Technology, in particular, for your continued support of this university. The guest of honor, as already mentioned by the Chairman of the University Council and the Vice Chancellor, MUHAS shall continue to conduct researches that are aimed at solving problems of the Tanzanian people. Let me assure you, guests of honor, that training at MUHAS, especially for postgraduate students, shall continue to strengthen the component of research in making sure that we produce the pool of critical thinkers and problem solvers in higher education and health. Guests of honor, we at MUHAS, we realize our responsibilities to ensure that our training, research, and consultant services that we offer support the government initiative to improve health of Tanzanian people. We thank you very much, guests of honor, and the government of the United Republic of Tanzania for continuing to support MUHAS. Guests of honor, as indicated by the theme of this year's conference, that is opportunities and challenges for tackling emerging health challenges. Strengthening research is important in order to address health challenges such as COVID-19 pandemic, which the government is currently addressing. We also thank you, the guests of honor, for your personal interest to continue supporting MUHAS, and particularly for establishment of academic and support facilities at the Mloganzila campus. Guests of honor, you are acknowledged from the time when MUHAS was constructing the MUHAS teaching hospital at Mloganzila campus. You made personal efforts to support us, and you continue to support us in the early stages when we are pressurizing this hospital. So for that one, we are very grateful, and I request all to give applause of. Guests of honor, you have continued to support MUHAS. You recently supported MUHAS through the Higher Education for Economic Transformation project, the HIT project. And your effort is appreciated. Through this project, MUHAS will be able to construct research and training facilities at Mloganzila campus, and such facilities and the human resource to be trained through HIT project will provide the needed support to address emerging health challenges such as COVID-19 pandemic. We therefore thank you personally, guests of honor, for supporting MUHAS to secure the financial resources for the HIT project. Guests of honor, we believe this project, together with the Center of Excellence in Cardiovascular Sciences, will be the catalyst for establishment of other academic and support facilities at the Mloganzila campus. Guests of honor, as you have directed, we will endeavor to continue enhancing our links with industry, local international organization, and the private sector
Since people are probably still having pictures, we think it's good that we start. May I now welcome you all to the next session, which is on keynote address. This session will be chaired by Professor David Ngasapa, whom we all know very well. May I now invite Professor Ngasapa to chair the session. One minute, please. Professor Ngasapa, now the floor is yours.
Hello, good morning, ladies and gentlemen. May I introduce to you Professor Japhet Kileo, who is a Professor Emeritus. And I think you know him well. There are only two, I'm told there are only two Professors Emeritus in this university. So I think you know him well. His topic will be opportunities and challenges for tackling emerging and re-emerging health threats. This is a keynote address. Professor Kileo, please, the floor is yours. We are a little bit behind schedule. We are about 20 minutes and 20 seconds behind schedule. So please make sure that you keep the time. Okay, please proceed.
Thank you so much, Professor Ngasapa, and also for the compliment. Good morning, ladies and gentlemen. Because I am short of time, I'm going to apologize. Protocol is observed. But let me note that there is a representative from SIDA, Swedish Embassy, and let me announce that I'm the first candidate, PhD candidate, product of SIDA support. So I'm very excited to have you here with me. You're welcome. My leadership this morning is to introduce the subject, opportunities and challenges for tackling emerging and re-emerging health threats. Can we advance the slides? So I was supported by SIDA SAREC to do the first HIV research in Tanzania, in Kagera region, and therefore I thought there was not going to be another epidemic. I thought HIV/AIDS was the last one and there would be no other. But unfortunately, we have many more to come. So I'm going to give a presentation today, and the outline is about emerging pandemic threats, drivers of the threats, emerging health threats, and microbial resistance as an emerging health threat, and also the One Health approach, opportunities, challenges, and conclusion. What are these emerging pandemic threats? These are acute, dangerous, previously unknown, and highly infectious diseases that newly emerge and cause pandemics. Recent examples are SARS, Ebola, Marburg, and COVID-19. A special USAID program was initiated in the year 2005 to minimize the global impact of these threats and preempt spillovers from wildlife amplification in domestic animals and humans and spread of future pandemics. First, the previous disease control efforts have produced very positive results. Examples are smallpox, which has been eradicated on the globe, on the world surface in 1979. Polio is next, and probably measles is going to be next. Of course, mortality has been decreasing with time in Africa and also globally. Malaria has also been decreasing worldwide, and it continues to decrease. However, new drivers are emerging, and so we should not relax. New approaches and innovations are required to respond to these diseases. Most important disease driver is the rising global population. The global population is increasing from 6 billion in the year 2000 to 9 billion. It's estimated to be increasing until 2050. And this is going to increase more in the developing world. And the rising global population leads to a surge in animal meat production. It is increasing exponentially, as you can see, because the food is necessary to feed the increasing population. Also, our livestock products consumption is going to increase, starting from eggs, meat, and milk. Growing population is also leading to dramatic increase in land use and agriculture. From 1700, hardly any agriculture on the globe, but in 2050, it is estimated that almost all the world surface is going to be agricultural land except deserts. Also, population increase is leading to accelerated encroachment on natural resources for wildlife. And you can see Africa, for example, 11% of the forest land was lost in only 15 years, while in Europe, forest land was gained by 4%. Also, population increase leads to increased demand for natural resources, gold, silver, tanzanite, and the like. And deforestation is accompanying that kind of demand. All those conditions collectively conspire to increase the frequency of interactions between humans and animals, and between people, domestic animals, and create opportunities for new diseases to occur. And with a surge in global travel, zoonotic diseases are no longer localized, ensuring that nothing is local anymore. Infection can start from China, and the next day of the surge in global travel. The rise in pandemic threats, mainly driven by zoonotic diseases. Of these, nearly 75% have animal origin, particularly wildlife. Examples are influenza virus, Marburg, Ebola, HIV, Nipah virus, SARS, and COVID-19, while only 20% originates from domestic animals, and only 5% are of unknown origin. AIDS is only a preview of the threats. AIDS emerged around 1930 from animal origin, and in 1981, it was first recognized clinically in the US. We are now witnessing between 5 and 8 new emerging infectious diseases per year, and the number will increase to about 30 by 2030. It's not very far from here today. However, most of these emerging infectious diseases will be mild or moderate and undetectable, but a few will be serious and cause serious pandemics like COVID-19. Epidemiologically, we see all infectious diseases have a characteristic epidemic curve, which is bell-shaped. And the first time we see an epidemic, we start panicking, and the detection methods coming, laboratory confirmation coming, response later, much later, when the epidemic is actually going down. But the best way to control this is to try all the efforts, regardless of whether there is treatment or not, to flatten the curve that way, so that we minimize deaths and suffering. Fortunately, disease emergency is not common. It's rare. It's a very rare event, and that is fortunate. So newly emerging diseases remain relatively rare events that occur at unpredictable times and places. Their early detection using traditional surveillance methods is difficult and very expensive. Therefore, rapid and reliable detection, prevention, and response to these highly unusual pathogens requires what's known as a risk-based approach. And the risk-based approach depends on 4 attributes which have been found to correlate highly with the origins of these new emergent diseases. And these attributes are certain geographic areas are more prone to these pandemics than others. Certain animal hosts are more prone to such epidemics than others, and certain microbial agents are also more prone than others to get these pandemics, and certain high-risk populations are at risk. So if we depend on these 4 attributes, then we are able to do very good surveillance of such emergent diseases. First, geographic areas that are most targeted. You can see that on the globe, there are 4 main foci where emerging pandemic threats are more likely to occur than in others. First, the Amazon basin in South America, the Congo basin in Africa, the Gangetic region in Asia, and the Southeast Asia region, where these pandemics are more likely to occur than in other places. Second, host species that are more likely to cause pandemics. You can see roots are caused by rats, bats, and non-human primates. These are common transmitters of these emerging pandemics. High-risk microbial agents that we target. These are RNA viruses, most common and most dangerous. They have high rates of mutation that makes them very dangerous, and they have high capacity to adapt to new hosts and cause disease. These are RNA viruses. Examples of these, which can cause, can infect and spread and cause human deaths, influenza viruses. I've already said about this. Retroviruses, examples are HIV/AIDS, coronaviruses, SARS and COVID-19, and filoviruses, Ebola and Marburg. High-risk populations. We are all high-risk populations. People and populations with high levels of exposure, directly or indirectly, to wild animals. Hunters, traders, wet markets, honey collectors, wildlife workers, and consumers of wildlife. Settlements near wildlife areas, residents there, domestic animals which are there, loggers, miners, and road builders around those places. These are high-risk populations for emerging pandemic threats. Now, re-emerging health threats. These are diseases that appear after they have been on a significant decline. Maybe due to breakdown of public health measures for diseases that were considered already controlled. May happen when new strains of known disease-causing organisms appear, or may happen due to change in human behavior, as may be the case of antimicrobial resistance. Examples of emerging health threats: tuberculosis, malaria, cholera, pertussis, influenza, pneumococcal diseases, gonorrhea, etc. Tuberculosis, as an example of emerging health threats, has emerged over the past 3 decades due to HIV infection, comorbidity, drug-resistant tuberculosis, and immigration. Global travel, people traveling from places where tuberculosis prevalence is high to other places. So diseases re-emerge. Antimicrobial resistance is an emerging health threat. This was already said by the guest of honor this morning. And antimicrobial resistance is complex. Its causes are complex and its solutions complex. This is what will happen in 2050, meaning that in Africa and in Europe, mortalities due to antibiotic resistance are going to have that kind of picture. Antimicrobial resistance happens when microorganisms change over time and no longer respond to medicines targeted to them. This situation increases the risk of epidemics, severe illness, and death. Antimicrobial resistance is mainly caused by misuse or overuse, which is human behavior. Misuse can occur in humans and animals and the environment. Antimicrobial resistance can occur when exposed to suboptimal levels of antibiotics or antimicrobials, such as those found in eggs, chicken, and meat. Here, nice eggs, but with suboptimal doses of antibiotics. Nice chicken with suboptimal doses of antibiotics. Nice meat with optimal doses of antibiotics. And wicked problem. A wicked problem is that which is difficult or impossible to solve because of incomplete, contradictory, and changing requirements that are often difficult to recognize. It is complex, its causes are complex, and its solution is complex. It cannot therefore be fixed by a single solution or magic drug like penicillin. Ritter and Weber in 1973 coined that figure of wicked problem, and they came up with 3 important characteristics of wicked problems. 1, every wicked problem is connected to another. 2, every wicked problem is unique. COVID-19. Solutions are not right or wrong. They are simply better or worse. Now, the One Health approach for complex problems, health problems. Emerging and re-emerging health threats and antimicrobial resistance have been designated as complex or wicked health problems. I've said this already, their causes are complex and their solutions are also complex. They therefore cannot be solved by a single discipline, but through an approach of collaboration, communication, and coordination, which is called One Health. The One Health approach is defined as an interdisciplinary strategy to address health from an integrated perspective rather than a discipline-based fragmented perspective. It is not a discipline like epidemiology. Rather, it's an approach. One Health has been there for a long time, even before the 19th century, but I just give this as an example. Rudolf Virchow, who lived between 1821 and 1902, said, he was a German physician and pathologist. He said, between animal and human medicine, there are no dividing lines, nor should there be. Now, One Health, unfortunately, our systems have been working in isolation, like grain silos, the picture there, without any form of communication among them. Human health, animal health, and environmental health, for example. One Health approach is designed to bridge these silos or sectors and allow communication, collaboration, and coordination for disease detection, prevention, and control. Working together, we shall eventually win the war against wicked health problems. But working in isolation, we shall fail. Now, opportunities for One Health approach. The first opportunity is that government is highly committed to the approach. For example, One Health was launched in Tanzania by the then Vice President Mohamed Garib Belal in 2013. And One Health strategic plan was launched by the Prime Minister, Honorable Kassim Majaliwa, in February 2018. Another opportunity, government commitment to the approach. Rabies elimination campaigns in Moshi in 2018 and in Kisarawe district in 2021 were successful due to government support. On the left, you can see the regional commissioner of Kilimanjaro. Unfortunately, she's no more, and she participated in that exercise. And on the right, you can see the district commissioner of Kisarawe. Fortunately, she's also a celebrity. She participated in the control program for rabies. Another opportunity is that there's already a One Health coordination desk at the Prime Minister's office with a clear One Health organogram. Another opportunity, presence of national level bilateral as well as international organizations supporting the One Health approach. USAID, GIZ, European Union, WHO, OIE, UNEP, FAO, AFROHUN, Global Health Security Agenda, etc. Presence of partner universities ready to train future One Health workforce, both pre-service and in-service personnel. MUHAS, Sokoine University, KSMC Co. I've highlighted MUHAS and SUA because they are the pioneers of One Health Tanzania. Opportunities. You can see that figure correctly, but there are more than, there are 9 countries Professor Kamuhabwa, you are welcome to this presentation. We have a short break because the situation is that we were actually waiting for you to come. Yes, we have just finished our coffee and therefore we were waiting for the arrival of these delegates, important delegates for the presentation. And so I was saying that MUHAS and Sokoine University have been a pioneer or pioneers of One Health approach in Tanzania, together with the support from the government, particularly the Prime Minister's office, which is very supportive of the One Health approach in Tanzania. We have gone through those dangerous things, and now I said the eggs are nice, but they are full of antibiotics, chickens, meat, wicked problem as defined, and the One Health approach, and opportunities. I've talked about the opportunity of government support and commitment to the approach by the then Vice President Mohamed Garibu in 2013 and the Prime Minister Honorable Kassim Majaliwa in February 20. Health approach is also having a coordination desk at the Prime Minister's office and those support organizations. And I was here, committed universities in Africa, and another opportunity is availability of training materials in one which has been co-authored by Professor Mdegela of Sokoine University and myself. And on the right is a professorial lecture book that also has a lot of training materials that I presented in the year 2019, just before the COVID-19. Utafikiri nilikuwa na chuo. Other opportunities are there, availability of well-trained students and student innovation clubs at all levels, universities and diploma levels, who are ready to strengthen the One Health workforce. Here is a picture of students from Sokoine University and MUHAS who have gone to Kilimanjaro to control rabies, to vaccinate dogs. And you can see those pictures. What are the challenges in One Health approach? Challenges facing One Health approach. One Health approach will continue to suffer from limited human resource underlined until there is a critical mass of workers in the human, animal, and environmental sectors. One Health coordination desk has not exercised its full potential in coordinating One Health activities in the country. The process is slow due to resistance to change by some sectors, and that is common to have resistance. Challenges facing by One Health approach, limited awareness of stakeholders about the wickedness of emerging pandemic threats and antimicrobial resistance. The unpredictable nature of emerging pandemic threats can make those responsible for response unprepared. Due to the wickedness of the problems, those who can do something about it may not be interested in solving the problem. And that's very common, for example, in the multilateral, multinational drug companies and antimicrobial resistance. They have very little interest to solve the problem because they gain by not solving the problem. Recommendations. beneficiaries in collaboration with regulatory bodies such as promoters and food producing animals. Raise awareness among university students about One Health. This is happening at MUHAS and Sokoine University, but not in the other universities in the country. Raise awareness among secondary school students about One Health. It's important. Raise awareness in communities about One Health. This is happening. Raise awareness about One Health and involve communities in disease control. This is an example from Moshi, where people were invited, communities were invited to come and vaccinate their dogs against rabies. Conclusion, we have described the drivers of emerging pandemic threats, explained possible reasons for their emergence, their patterns, trends, and hotspots. We have described antimicrobial resistance as another emerging pandemic threat, and we conclude that these wicked problems cannot be solved by traditional approaches, but by the One Health approach. There is therefore a need for creating a One Health workforce sufficiently capable of early detection, prevention, and response to these threats. This forum, the conference, MUHAS conference today, is being requested to promote the concept and support One Health workforce development in Tanzania. Thank you so much. Here I'm saying, I'm asking the question, are we prepared for the next pandemic or disaster? And the simple answer for this conference is no, we're not prepared. We must educate the people to take preventive measures seriously. The chickens here are already taking precautions very seriously. I have some materials distributed to all conference participants. These are pamphlets of AfroHoon, the organization for which I am a country manager for One Health. So please take a copy as you walk out. Thank you so much.
Thank you very much, Professor Kileo. I thought you were going to distribute eggs, but now pamphlets. Thank you very much. Now, first of all, I just want to thank you very much for keeping time. Yeah, you have tried your best to keep time. And I would like to now invite questions. Just take, because of the shortage of time, we just take, because there is also a satellite meeting in the room, lecture hall number 5, about the same topic. So even if we don't deal with all the questions here, we'll move to the next session to be in lecture hall number 5. So may I now invite questions? But before that, let me be selfish enough just to keep the ball rolling. I would like to ask Professor Kileo, it's very, very interesting about this emerging, this One Health approach. But you mentioned the about the collaboration with other universities, One Health approach, the government, how it is supporting it and so forth. But I'm not sure whether at a research level, in trouble to do research in this problem for health, and second, for One Health. And second, are we thinking of maybe integrated curriculum or something like that in the universities to solve this problem? That would be my question, just to set the ball rolling.
Thank you for that question. Research in emerging pandemic threats is being done, especially at the moment. People are submitting proposals, and I think by next year, there will be very many funded proposals. The case because people were scared about COVID-19, and now it seems the scare has been lost. See, it has been lost to the extent that I've even forgotten my mask. So I think it's very positive. Universities are going to be very active in research from now on. Regarding curriculum, yes, this is an exercise which started in 2017. We have already integrated One Health content into the university curriculum, MUHAS and Sokoine University. And next year, beginning October this year, we're going to start integrating One Health approaches on content in the other universities. KSMC going to start integrating One Health content into their curriculum. And it's only Tanzania which has been able to integrate One Health content into diploma and certificate level training colleges. And we are almost halfway now. Health, agriculture, livestock are already rolling out these newly integrated curriculum nationally. This is very fortunate. It's only Tanzania. The other countries have not started this. So we are being praised for that.
Thank you very much, Professor Kileo. Now let me invite, let's start from here. I can hardly tell your faces because of the mask. I can hardly recognize you. Please, come, please. Maybe somebody can pass to him.
Thank you very much. I'm happy that Professor Kileo is still very active. Now I have two things that I'm requesting to reiterate. One is that we have talked about the fact that some of the solutions or some of the interventions are either for better or for worse. Would you mind to elaborate more on that? And the secondly is that you are highlighting that some people are not interested in solving the problems because they benefit from not solving them. Thank you.
Thank you so much for the questions. Yes, solutions. One of the characteristics of wicked problems is that wicked problems, the solution that is brought about by responding to these emerging pandemic threats is either, it cannot be right or wrong. It is either better or worse, because we are in a trial stage where we are trying to see which solution shall we use for a particular pandemic. And so by trial and error, if you are lucky, the solution will be better. If you are unlucky, the solution will be worse. And so this is the stage of responding to pandemics. The other question is about those who are most capable of making a solution to these problems are not interested because they benefit from the problem being there. And an example is multinational drug companies. They make sure they benefit, they get high profits of selling a particular drug, even though that drug is not effective. Because if they don't do that, they will not get any money. So they are not interested. So to fight these people is difficult. They are rich. They are very rich. You can't fight rich people.
Okay, any other question? I'm moving that way. I'll take maybe 2, 3, because we are limited with time. So maybe I take from that angle. Somebody from there had raised that. Nobody. Yeah? Okay, I'm saying. Please. That one. And then I'll take one here and then there. Yeah, I'm pretty mic. Yeah.
Thank you, Professor Kyo, for the very informative presentation. My name is Phineas, postgraduate student in the St. again. I have a question on the One Health approach. In our career, we see there is a gap between biomedical engineers and we clinicians. Sometimes we are not competent enough to do the clinical research because of lacking the engineering part. And in the past, these biomedical engineering engineers have been suggesting that maybe they should be working under the Ministry of Health instead of the ministry they are working currently. Now, in your view, how do you think that we can merge and bridge this gap? Can we introduce the biomedical engineering curriculum in the medical curriculum so that we can make these two things together? Thank you very much.
Thank you for the question. I think it's not necessary to do that. It's not necessary to do that because the idea of One Health is collaboration, communication, and coordination. Those are experts in their own area, and you are an expert in your own area. Don't bring people into your department and think that we work together. Let them think One Health. And
I was trying to see if I know in Tanzania with this health system that is convention based, but we have other key players in health provision that is alternative, including natural products and the local people, traditional healers. These also are the dear partners. But as I was looking around, I couldn't see how these are involved, because they also have some remedies that can solve in these evil diseases. And their products can also help in tackling this drug resistance. I've seen somewhere where local people were invited to bring their dogs for vaccination. They were invited, but they were not involved as the key players in interdisciplinary approach. How do we tackle that?
Thank you very much for that question. Yes. We into One Health. Traditional medications, just like any other medications, are important. And so if you have an innovation surrounding traditional medication, please bring it forward, not to me, but to the coordinator of One Health in Tanzania, who is seated at the Prime Minister's office. And that will be taken on board so that we can respond quickly to any emerging pandemic threat. Thank you for bringing that up. It's an important area for consideration in the One Health stakeholders. You are a stakeholder in the One Health approach. Thank you so much.
Thank you very much. Now, to be gender sensitive, things have been asked only men. Now, let me see Dr. Gasarase, please.
Thank you, Professor Kileo, for the very informative presentation. I was just thinking about my antimicrobial resistance and looking at chicken farming. Chicken farming is a source of food, and it's also a lucrative business for the community, different communities. Now, if the chicken suffer from infections and they have to be treated, so how do we control the management of the diseases in the chicken and the cow, antimicrobial resistance, which originates from that source of?
For this question, I have to stand up. Thank you for that question, Sarasi. Yes, that's why that is a complex problem. It's a wicked problem because just imagine a poor lady who has taken the Koba, borrowed money to raise chicken. And the next Saturday, she has to pay back the money or part of the money. Just imagine she is now having some of her chickens sick, producing eggs, but they are sick. And she has to benefit from selling the chickens or the eggs. She's producing 1,000 eggs per day. And here comes a veterinary surgeon and says, oh, madam, you have to throw away your eggs for 2 weeks because you have been treating your chickens with antibiotics, because that's the rule. This poor lady cannot throw those eggs away. It is impossible, even if it is me or you. And so that's the complexity of it. How do we help that lady to cross the border between returning the Nicoba and keeping the chicken and not using the antibiotics. Sometimes the antibiotics to the chickens are not necessary, or if they are necessary, then you have to have a withdrawal period of 2 weeks before you sell your chicken and before you sell your eggs. That is the complexity of the matter. But in certain countries, there's a compensation mechanism for such situations where you have to throw away your eggs, and they really throw away their eggs. The only issue here, which is another complexity, is where do you throw your eggs? It's another complexity. If you are spoiling the environment with the antibiotics, small doses of antibiotics in the environment. I think the Vice President Environmental Management Council should come in and instruct people where to throw the eggs and how to throw them. This solution is better and not worse. Thank you so much.
Thank you very much. Members, let me say, because of the limited time, let me take this opportunity to thank you again, Professor Kileo, for, I think it was a really educative presentation. So thank you very much, but I understand some of you might still be having some questions, and I think this we can, in the lecture hall number 5, we can continue there and try to sort out your problems. Let me thank you very much, and again for the organizing committee for trusting me that I can chair this session. Thank you very much.
That pamphlet which I've distributed around has my email address. If anybody is interested to ask questions, please you're welcome to use it.
Thank you so much, Professor Kileo. Thank you so much, Professor Ngasaba. May we now applaud for the 2 professors. Thank you so much. This brings us to the end of the plenary session. And next is a parallel session, which is to happen in lecture theater 4, 5, Chipe, and seminar room 1. But we will also have in the afternoon satellite sessions. And so please, you may have your questions answered there. You are welcome now to move to different positions depending on what you want to attend after this session. Thank you so much.
Imetupwa chini namna hii. Wewe jamaa, chini ndio ni afadhali. Kwa hiyo chini ndio unaona afadhali, sio pale juu. Kwa hiyo umeshaanza kumasa. Angalia basi kisichakae sana cha watu kiweka kiwaga mwisho wa siku. Hapo utaua. Unaona ushaanza kucha hiki umechomeka hii nani kwa nani ile no usifanye kitu cha namna hii. Bila hiyo sasa ile sasa usije ukafanya vitu vya namna hii. Tunakuja kuua Amini Raimu amesema na nani anajitahidi kuitoa. Amini Raimu amesema anashughulikia hiyo. huu mchezo nani ukichanganya chaji zitaanza kuwa shida na hatutozipata. Kwa libe hii huko ndo chini kwake ndio inaonekana inafanya kazi. Kwake hapa ndo optimal point. Ila uploading ilikuwa kubwa pale juu. Downloading hata hapa so. Haya, asante kwa taarifa. Hivi, jaribu hapo. Naona hapo kama kuna nafuu. Pale ndo sawa. Mbona extension hii? Mbona kinachokwambia? Hapa tasikia yake.
Dear delegates, we should now be settling to start our satellite session. Am I audible? Audible to the backbenchers also? Okay, fine. So we have been honored enough that our satellite station actually bears the name of the main theme. And I just hope that we have very ready presenters, and our satellite station is going to present even the keynote speech. So sit back, relax, prepare your questions, and I am looking forward for a very interactive satellite session. So just to orient, we are in lecture theater 5. And as you might know, some other satellite sessions are ongoing in other lecture theaters. But we would be very delighted if most of you stay here. So our main theme or sub-theme here is emerging and re-emerging infectious diseases. Actually exploring a lot linked between also communicable and non-communicable diseases, as you'll see. I have an honor to introduce Mr. Baraka Morris, our rapporteur. Yes, and feel free to tell your questions as such. So we'll have 4 presentations, oral presentations, and we'll start with Dr. Gerald Makuka, who is a senior resident at the Department of Internal Medicine. He'll present on prevalence and factors associated with active tuberculosis among diabetic patients at Temeke Regional Hospital in Dar es Salaam, which has been part of his dissertation. Dr. Makuka, without further ado, karibu sana.
So thank you, Chair. My name is Jared Makuka, and I'll be presenting to you our research study entitled Prevalence of Tuberculosis in Diabetic Patients Attending Diabetic Clinic at Temeke Regional Referral Hospital